Welcome everyone. My name is Irfan Ahmed and today we are going to study about general pharmacology. So pharmacology is one of the basic subjects in the B Pharma course. It's also included in diploma, B Pharm and nursing and other courses. So here in this we will study about the basics of the pharmacology, the basic definitions of the pharmacology, the basic routes of drug administration, absorption, distribution, and what the drug does to the body, what the body does to the drug. So we will study about pharmacodynamics, pharmacokinetics, various modes of excretion, and various methods of biotransformation, or what we can say that metabolism. So these things will be studied here in general pharmacology. So let us start. So first of all, we must know that what pharmacology means. What's the pharmacology? So if we, in simple terms, if we talk about the pharmacology, so pharmacology is basically the science of the drugs. We can say that pharmacology is the study of drugs. So here in this subject we study about the drugs, their mechanism of action, their adverse effects, their uses, their contraindications, and what the body does to them, like absorption, distribution, metabolism, excretion. So all these aspects we study in pharmacology. So basically it is derived from two words. One is pharmakon and another is logia. So pharmakon, what pharmakon means? Active principle or active ingredient or equivalent to drug, medicine or poison. So pharmakon means active principle. If we take the example of any drug, like for example, I will take the example of the paracetamol, PCM. So in paracetamol, there are active ingredients, and there are other things which are added to that very drug, that are those are called as excipients. So the main drug paracetamol, that's called the active principle, okay, which brings about the change in our body. So that is called the active principle. And the other things which are added to that very drug to increase solubility, etc., to enhance or to impart the color to that very drug, those are called excipients, like titanium dioxide, that is the coloring agent which is used. So that is an example of the excipient. Okay. And logia means study, means in this subject we study about the active principles, their effects, their uses, etc. Okay. So in simple terms we can say that pharmacology is the science of drugs. It is the study of drugs, in which in this subject we will study about drugs. Okay. So if we come to the definition of the pharmacology, that was the meaning of the words pharmacology. Now we will go about the definition of the pharmacology. Okay. So what pharmacology basically means? So it is the study of those substances, or we can see that it is the study of the substances or chemicals. Okay. Those chemicals that interact with us, that interact with the living systems through various chemical processes. And the main mechanism especially is they bind to the regulatory molecules, like enzymes, etc. And by that, if when the drug enters into our body, it will bind to some regulatory molecule like enzyme, etc. And then what it will do, it will show its effect. So either it will activate the normal body process, or it will inhibit the normal body process. So two things will happen. Either there will be the activation of the normal body process, or there will be the inhibition of the normal body process. It depends upon the cause of the disease. It depends upon what there is because of which factor the disease is occurring. So it depends upon those very factors. So it includes the history, sources of drugs, from where we get the drugs, properties of the drugs, how we are compounding those very drugs, how we are manufacturing those very drugs, what are the various biochemical effects of that very drug, what are the various physiological effects of the drugs, PK value and PD value, therapeutic and other uses, and precautions, side effects or adverse effects. What are the various interactions if we give two drugs together or two or more drugs together, and what are the contraindications? Which drug can be given at which place? For example, there are some drugs which are contraindicated during pregnancy or during lactation. So all these things we will study in the pharmacology. So if we talk about the basic definition of the pharmacology, so it will be that it is study of those substances which interact with our living system, and they bind to various enzymes, etc., and they either activate the normal body process or inhibit the normal body processes. So that is the definition of the pharmacology. Now, what drug means? We have been using the word drug in the past slides. We have been using this word. So we must be knowing that what the word drug means. So it is a French word. Actually, it is a drogue, which means a dry herb. Because in the past times, maximum the drugs were obtained from the herbs. The herbs were converted into the drugs. So drug, what it basically is, it is any substance that will bring about a change in the biological function. If we take that substance, that will bring a change in us. So how that will bring a change in us? It will bring a change because of the chemical action. So that's called a drug. Means it changes the state of the body. It changes the state of the body. It can't create a new function, but it can change the existing function. For example, we are having a normal body temperature of 37 degrees centigrade, and if we are taking a drug at that increase our body temperature, okay, so that is the change of the function. So it does not create a new function, it only changes the function. So drugs are poisons if these are used irritationally. For example, paracetamol is a medicine. Now, if we use, for example, diazepam, paracetamol, alprazolam, alprox, which has a brand name that's alprox. So, trade name alprox. Alprazolam is a drug that is often used as antidepressant or anti-anxiety drug. So, that is used as a medicine in a low concentrations. If we use the same alprazolam continuously, for example, if we have to take one alprazolam at bedtime and we are taking 3 to 4 alprazolams, so that will cause its function into the poisons, because we are using it in overdoses. So overdose of any drug, that will make it a poison. Okay. Now next thing which we have to study in this general pharmacology is receptors. So what receptors are? These are the specialized target macromolecules. So these are the macromolecules, big molecules, which are present on the cell surface or which are present in the cell. So they must be extracellular receptors, there must be intracellular receptors. Intracellular means which are located or which are present inside the cell, and on the cell surface those are called as extracellular molecules or extracellular receptors. Okay, so these play a regulatory role, means they can either increase the function, either they can decrease the function when the drug binds with them. So what happens when drug binds with the receptors? It causes a change in biochemical activity of a cell, and because of that the function of the organ is changed. Okay, so when drug will bind with receptor, for example D is the drug and R is the receptor, when those will bind, what they will cause, this will cause a change in the function of the organ. Okay, and sometimes that drug may act through non-specific mechanisms, like for example there are some drugs which don't act at receptors. Then what they do, for example osmotic properties, for example there are bulk laxatives, there are purgatives, there is mannitol. These don't act with the receptor, but they have the osmotic properties, and because of these properties they cause a change in the function of the organ. And there are other examples like adsorbents. I will take an example of kaolin, charcoal. Okay, so these are used in the condition of diarrhea. So what charcoal does, it absorbs the fluid. So these are the different functions. Now there are basic areas of pharmacology. There are some deep areas of the pharmacology which you must be knowing about. So pharmacokinetics is the first one which is important. Pharmacokinetics and pharmacodynamics. Pharmacokinetics and pharmacodynamics. So what pharmacokinetics means? What the body does to the drug, means when the drug enters into the body, what body does to that very drug, that's called as pharmacokinetics. So it includes ADME, so absorption. So body will, first thing what body will do, it will absorb the drug, then it will distribute the drug in our body, then it will biotransformate it. Biotransformation is the chemical alteration of the drug, and after that it will excrete the drug. So this is included in pharmacokinetics. Second one is pharmacodynamics. So what pharmacodynamics means, what the drug does to the body. Now what drug does to the body? So what will the drug do to the body? It will cause physiological effect. Okay, it means it will act on the cell or any receptor, that is called as the MOA, mechanism of action. So it is included in the pharmacodynamics. One more thing is there, pharmacotherapeutics. So it is the use of drugs in the prevention and treatment of disease. So that area is called as pharmacotherapeutics. It's also important from in the pharmacology view. Next is chemotherapy. So chemotherapy means the therapy by use of the chemicals, which is basically mainly used in the cancer. So effect of drugs upon microorganisms. What are the various effects of the drugs upon microorganisms, upon various parasites, upon various neoplastic cells, means cancer cells, and multiplying in living organism. One more thing is there, that's toxicology. So it is one more branch of pharmacology which deals with the undesirable effects or adverse effects of the drugs on living systems. So we are taking the drug, almost each allopathic drug is having one or any other side effect. So those side effects are those adverse effects, those we study in a separate subject of a separate area of pharmacology, which is called as toxicology. And one more is there, pharmacogenomics. Okay, genomics. So it is the relationship of individuals genetic makeup. Makeup means DNA, etc., to response to specific drugs. So each individual or each person, it responds to the drugs in a different manner. So we study here in we study that in this separate area, that is pharmacogenomics. So the next thing is history of the pharmacology. Okay, so the older people, those were the prehistoric people, means the ancient people. So those recognized various beneficial effects, various toxic effects of many plants and many animal materials. Okay, now then we came to the modern era. There were various attempts. We were using the rational methods into the medicine, and after the end of the 17th century, so there was the main focus was on observation and experimentation. That was the main thing. So in the prehistoric times or in the ancient times, there was no observation, there was no experimentation. That was just a hit and trial. Okay, so now in this era, in the modern era, what happens is that molecular mechanism of various drugs is known. So now that has been changed only to the observation and experimentation. Now what are the various applications of the pharmacology? First application is it controls the speed of onset, intensity of drugs effect, what is the duration of action, how long the drug will act in our body. Okay, so hence decide on the various routes of administration, the frequency, amount, how much amount of the drug is to be taken, what is the frequency of each dose which we are taking. For example, we are taking in the morning, then we are taking in the afternoon, then we are taking in the evening. So that depends on the frequency. And what are the various dosing intervals? So what distance we have to keep between the various doses. Okay. Second the second application of the pharmacology is we identify various possible side effects, withdrawal symptoms. For example, we are taking some drug for a long period of time. For example, there is a diazepam. If you are taking a long amount of time and abruptly you are stopping that very drug, so that will show the withdrawal symptoms. Okay, now those withdrawal symptoms will be managed by us. So that will also be application of the pharmacology. Next application is to avoid the adverse effects. How we will avoid the adverse effects from either drug interactions or contraindicated drugs. Next is to avoid adverse effects in special populations like geriatrics are there, patriotic small children are there, pregnant women are there, lactating mothers are there. How we will avoid the adverse effects in those populations, because there are some drugs which are having maximum adverse effects in patriotics, pregnant and lactating mothers, or geriatrics, old people. Okay, so how to manage these, how to avoid these adverse effects, that will be the application of the pharmacology. And next is how to avoid the treatment failure due to tolerance. Somebody is having a tolerance to a specific drug, or somebody is having a resistance to specific drug due to genetic makeup. How we will avoid that, because that will cause a treatment failure. Tolerance and resistance both will cause a treatment failure, and how to avoid that very treatment failure, that will be the application of the pharmacology, and that will be avoided because of the pharmacology. And next is that how we will control the misuse of drugs. Okay, so some drugs are misused by the common people, or by some people. Some drugs are misused. How we will control that misuse of drugs, that will also be an application of the pharmacology. So drugs those mostly interact with specific molecule in a biologic system. For example, mostly they interact with a specific molecule, and that specific molecule here mostly is a receptor. Okay, and clinically, why the drugs are used? What are the uses of drugs? These are used for diagnosis. For example, barium salts, which are used in the diagnosis. Prevention, for example, vaccines, chemoprophylaxis, treatment, cure, treatment, angiotensin receptor blockers, ARTs. It is an example of the drug category. Cure, for example, antibiotics. Change in physiological processes, for example, hormones, their derivatives, insulin, which is used in the diabetes, gonadotropin hormone, contraceptives. Okay, and global effect, for example, general anesthetics are there, which are used in the generalized surgery. Okay, so there are various uses of drugs. I have mentioned some of them. So these are the basic uses of drugs, basic areas where the various drugs are used. Next is, those drugs have the, what is the use of those drugs is that they interact chemically with the receptor. Okay, when we take a drug, that drug goes into our body, interacts with the receptor. A drug molecule must have for interacting with the receptor. Okay, to interact chemically with the receptor, a drug molecule that must have a specific properties, like its size must be between 100 to 1000 Dalton, means molecular weight of drug must be between 100 to 1000 Dalton. Only that then it can specifically or chemically combine with its receptor, interact with its receptor. And for that, the ability to move within the body. Okay, means a drug, because of this size, drug can move from the site of administration to the site of action. For example, if the site of administration is intravenous, so from intravenous to the site of action, it must have a molecular weight between 100 to 1000 Dalton, not more than that and not less than that. So electric charge, that must be a bonding, because there must be a bonding. Shape, that must be complementary to that of receptor. Okay, in the same way, like we must have heard about the lock and key hypothesis. So most of the drugs are chiral molecules, means in which one carbon atom is attached to the 4 different atoms or groups of atoms. And another thing is atomic composition. So a number of useful or dangerous drugs. So maximum number of useful drugs or dangerous drugs, those are inorganic elements. For example, lithium, iron, heavy metals. If we misuse them, they can be dangerous drugs, and sometimes they are useful. And many organic drugs are either weak acids or bases. Okay, why? Because these are well handled in acidic or basic medium, because pH differences are there in the various compartments of the body, and they change the degree of ionization. They change the degree of ionization of such drugs, that's why. And what are the various sources of drugs? So sources means from where we are obtaining the drugs. So there are various sources. For example, some drugs may be synthesized within our body. Hormones are not. For example, xenobiotics, means xenobiotics are obtained from outside, and hormones, those are synthesized within our body. So either the drugs can be synthesized in our body, or they can be xenobiotics. So maximum of the drugs are xenobiotics, means they are stranger. Those we take from the outside. So this was all for the today's lecture. In the next lecture, we will continue the general pharmacology. We will continue from the sources of various drugs. So that was all for the today. Thank you.